Okay.
Yeah.
All right. Good luck, everyone. See you afterwards.
Bye.
Okay, good evening, everyone, and welcome to our YouTube Live this Monday, and it's World Pharmacists Day, so happy World Pharmacists Day, everybody. We're really excited about this event because, for a start, I don't think we've had anyone from the pharmacy team on one of our live events before, and it's great to be able to celebrate the pharmacists and other roles within the pharmacy team and all the work they do, because I think, you know, we've all heard of pharmacists, but we might have quite a narrow view about where they work, what they do, and I'm really confident that in the next half an hour, 45 minutes, you're going to hear about roles that you never even knew existed, and different ways that pharmacists, pharmacy technicians, pharmacy assistants are working. I'm Abby from the NHS Health Careers team, and really pleased to be joined by members of the pharmacy team today. So I'm going to get them to introduce themselves in a minute, and then what we'll do is I've got some questions for them, and then you are able to answer your not answer your questions, ask your questions. So please do put your questions into the chat, and we will try and get through as many of them as we can. So yeah, please don't hold back. We've got three amazing panelists here, and they are ready and willing to answer your questions, so please do go for it. Okay, so if I could just get the three of you to just introduce yourselves before we get kind of stuck into the questions. I'll just go around in the order I can see on the screen. So Amrita, would you go first, please?
In Queen's Medical Centre.
Thank you, Jo. And Wendy?
Hi everyone, I'm Wendy, and I'm a clinical pharmacist working in a primary care network based in Enfield, and I also do local and community on the weekends as well.
Brilliant. Thank you all so much. And I'm really excited because we've got a great range of kind of settings that you're all working in as well, and we'll hear more about that as we get kind of stuck in. So Wendy, I'm going to start with you. Can you tell us a little bit about your career journey since leaving school, please?
So yes, I have always wanted to be a doctor. So during my A-levels, I did apply to study medicine. However, I didn't get into medicine. So during clearance, I was speaking to my mum, and she recommended pharmacy. And I was just, I don't know what pharmacists do. Pharmacists are always like dashing out medicines. I don't want to be that. And she encouraged me to go for the course. So my first year of uni, I didn't really enjoy it because I didn't know what I was doing. Second year of uni, got a little bit more like chemistry side, biology side. I was like, okay, I kind of like this. And then I just plugged myself into it, enjoyed it all the way through. And yeah, here I am working as a pharmacist. So yeah.
Brilliant, thank you. And what we always really enjoy on these live events is when there's some, and this is going to sound weird, but when things haven't necessarily gone totally to plan, because they often don't, do they? And we need to find different ways to do things, different ways to get there, or have a plan B. So yeah, clearing is a great example of the opportunities that can come up. Wendy, this might be a difficult question to answer, I realise, but do you have a typical day? And if so, what's it like?
So working in primary care, so I have always worked in primary care since I qualified. There is nothing like a typical day. So it could be anything from in the morning coming in, having a clinic, and it could be a wide range of chronic conditions, so from diabetes review to heart failure to asthma to hypertension, whatever. Or it could be a doctor coming to you saying, hey, I've got this patient, I'm not too sure what to do in terms of medicine, would you want to research and then give me some advice on what to prescribe? Or it could really be like doing flu clinics, it could be doing vaccination clinics, so it could just be a lot of things on a day. Yeah.
Brilliant. So a lot of variety then. And so, just Wendy, just for the people watching who might not know, primary care is so you're based in a GP practice or several GP practices, are you?
Yeah, so I'm part of a primary care network, meaning that I work across different practices, so GP surgeries within Enfield. But I'm usually based in 2 surgeries, but every now and then, if we do have a project coming up, I can be asked to help in a particular surgery, and then I would, help over there. I'm usually based in 2 surgeries. So I get to have that contact with patients and follow up on them as well. So it's not all lost.
Thank you, Wendy. And Rita, if I could come to you next, please. So same question in terms of kind of what, potted history of your career journey since school.
So in secondary school, and I think year 10, we had a careers fair where a pharmacist spoke to me. And then I went on to do some work experience when I was in year 11 at my local Lloyd's pharmacy, and kind of just got a feeling of what pharmacy was like. But I knew that I liked more of the application that happens in hospital as opposed to the shop dynamic in community. So I ended up doing some placements in hospital pharmacy, and that's where I really fell in love with it. And then I did my pre-registration training in hospital, and then I've just stayed in hospital since. And so I did like my junior training years in a certain hospital, and then I moved over to the one I'm in now. I did my senior training years, but then chose to specialise in critical care.
Brilliant, thank you. And what kind of appealed to you about pharmacy? What was it that made it? So what did that pharmacist say to you at that careers fair that kind of got you a bit hooked and made you want to go down that path?
So for me, I just knew which subjects I excelled in at school. Like I really enjoyed chemistry, I enjoyed biology, and I loved maths. So for me, it was kind of like the ideal fit. I wasn't someone that was quite good with, I guess, blood and, touching paint, like that kind of thing. It wasn't really something I was interested in. So nursing and medicine wasn't a route I wanted to take, but I still wanted that involvement, and I still wanted that impact in the patient journey. So for me, pharmacy kind of fit perfectly in that role, especially in hospital, because you're so involved in that patient journey. You're not just around pharmacists all day, you're around doctors, nurses, physios, occupational therapists, dietitians. It's like a whole faceted role. You're not alone in hospital. So I think with pharmacy in hospital, what I really like is the fact that you're not just learning off other pharmacists, you're also learning off other healthcare professionals. So you're constantly learning different skills. And in critical care in particular, a lot of our management is around organ support. So whether that be for your lungs, so a ventilator, for your heart with special drugs, or even for your kidneys with like a filter device. But drugs impact each organ differently. And I think critical care pharmacy lets you explore that more. So I think that's what drew me to pharmacy the most, was just how many different things I can learn every day, as well as looking at the body as a whole.
Yeah. I really like what you said about kind of, not being that keen on blood, but really still wanting that involvement with patients. And I think, that's something as a health careers team, we sometimes get people saying, oh, but I don't like vomit and I don't like blood, I'm not going to be able to do anything. But there are so many roles, aren't there, where you can still have that patient contact, but not have to deal with that if that's not what you want to do, which is fine. Great, thank you. Joe, guess what question I'm going to ask you? What's your kind of career? What's your career journey been like since school?
So I went to sixth form. Like Rita, I always sort of liked my science subjects and my maths. And I originally applied to go on to university to do biology. And then I kind of got there, and within a month or so, I just kind of realised, as much as I loved the subject, I didn't want to be learning in that type of environment, sort of, especially not straight from school. So I ended up taking a bit of a step back and had a bit of a gap year, and just sort of worked in retail for a little bit, really, which again, I loved aspects of retail, but I missed that science element to things. So I don't know, I think someone just mentioned it in passing to me one day, like, oh, what about pharmacy, or like a community pharmacy? And honestly, until that point, I wouldn't have even considered knowing what a technician or a pharmacy even did. So from there, really, I just kind of started looking at work for the hospitals, and there was a job come up for an apprentice pharmacy assistant. So I went and I did that course. I really enjoyed it, and then I went on to do yet another course to become a pharmacy technician. So I kind of just worked my way up through through the hospital environment, really.
Brilliant. And so another example of someone where things haven't gone to the original plan, and you that takes a lot of courage actually to say, do you know what, this isn't working for me, I need to find a different way to do this. So that's brilliant to hear that you've been able to kind of progress your career through apprenticeships as well, because presumably that means you've been getting paid while you've been doing your training.
Yeah, that was one of the massive benefits to it. It's, even though it's not obviously not the best pay in the world, it's better to be getting money alongside while you're doing something you're enjoying.
Yeah, brilliant. And Jo, for you, again, kind of, I know this might not be the easiest question to answer, but what would a typical day look like? Can you kind of walk us through it?
Yeah, so again, that's another reason that I really like the job, is the multi sort of tasks that you have to do in a day. But for me, I think I kind of come in, I have regular contact with patients on the wards, maybe get to talk to them when they're admitted to hospital, see what medicines are on at home, if they're getting on with those medicines, if they've got any problems. And then also there's that patient journey of seeing them while they're in hospital, sort of get better and well enough to go home. Then there's the chance to talk to them again about any new medicines they might be taking or amendments to their doses perhaps. And just it's giving that patient a chance to ask all the questions to feel comfortable to go home. The last thing in the world you want to do is be going home from hospital scared, you don't know what you're doing. So we're kind of there as like that friendly face to be like, no questions, silly, no matter how big or small, we're there to answer it for you.
That's great. So it's not just the science knowledge that you're using in your job, but there's a real kind of reassurance and almost like a counselling element to your role by the sounds of it. Yeah,
for sure. A lot of it is just having the patient be calm enough to know that they're happy with their knowledge on something before they leave.
Yeah, brilliant. Thank you. Okay, Wendy, I'm going to come back to you. You've touched on this a little bit already, because you mentioned that the GPs are sometimes coming to you for advice about medicines, and that might be a surprise to lots of people that because I think a lot of people think, well, that it's the GPs who are making all the decisions, but that's where pharmacists come in terms of offering advice. What other members of the team do you regularly work with?
Yeah, so just to start off with people being surprised, I think it's worth noting that pharmacists are experts in medicines, so we do have like the knowledge in the medicine. So the GP's part, the doctor's part is to do the diagnosis, and then we would just make sure that the medicine being given out is safe and appropriate to use. So I work with a lot of people in the GP surgery. So we do have like the physiotherapist, and they act in the role as a first contact practitioner based on site. So we do have pain patients, and if we do want to refer them we refer them over to the physio, and they make the onwards referrals. We do have advanced nurse practitioners based in the surgery as well. They could do the triaging if people come in with an acute case, and then triage it to the appropriate clinician. We also do work with the phlebotomist. We do have that on there. We do like retinal screening, so people looking at the eye also on site. So it's just a whole lot of people working in one space, and it just makes it so easy to learn from each other and also to refer, and then that gives the continuity of care, so you don't have to wait and then you can just literally pop into someone's office saying, hey, I've got this patient, do you mind seeing them? And then you just get seen. So yeah, it's just a lot of people working.
Nice. So that real feeling of everyone contributing their kind of bit to that patient journey and to make a difference for patients. I love that. Thanks, Wendy. Again, you've touched on this already, really, but can you tell us a bit more about that connection between what you do and patients at the end of the day?
So I think I feel like pharmacists is very special, because sometimes you do get a patient coming in. So we do have face-to-face. So you get a patient coming in and they're just like, prescribe this, I don't know how to take it, I don't know what to do. So we just sit down with the patient, counsel them on how to take it, just tell them what the drugs do. And we do have patients who sometimes like struggle to take their medicines, so we can arrange for them to be put in boxes for them, which makes it easier. And also like we tend to deal with, in primary care, pharmacists tend to deal with chronic conditions. So we do monitor the journey of the patient. So if you've been diagnosed with diabetes, the pharmacist is going to take care of you at each step. making sure that medicine you're on is still safe for you. If it needs reduction, if it needs increase, pharmacists are able to do that, and we do have that as well. And in terms of my community background, as I said, I do a community row on Saturdays as well. I tend to see patients with acute cases. So you'd have a child coming in saying, I'm coughing. And then you as a pharmacist would have to deal with the child because it's a Saturday, mom wants to go to the playground. I've got this ready for you, and then help them there as well. So we do have acute cases in community, and then in the GP we do the chronic condition management.
Brilliant. So again, variety is obviously what, one of the things that is great about what you're doing. Thank you, Wendy. Joe, if I could come back to you and just ask you a little bit more about the apprenticeships that you've done. First question is how long did each apprenticeship take to do?
Okay, so the first one that I did to become the pharmacy assistant generally is about 12 months to about 18 months. So I think you just have to do I think it's a bare minimum of 12 months sort of on the job, and then you have your on your job side, and then you have sort of your college day release to do sort of the theory side of things as well.
Yeah.
And then the second course, the technician course, obviously is a bit longer, and I think it's like an equivalent to 3 A levels, and that one, I believe it's a minimum of 2 years, but it can be between 2 and 3 years, that one.
And how did the split work between, so you mentioned that you've got the hands-on learning, you've got the more kind of classroom-based academic work learning. How did the split between those two things work in general?
Honestly, I think it was quite nice. Sort of all the work from the college was kind of laid out quite clearly in terms of, they say you're supposed to have 10% off the job. So that 10% basically could be your college day, for example. So imagine apprentices normally work Monday to Friday and have a set number of hours. So that college release day is like an equivalent to that percentage.
Yeah.
And then you go away and sort of have kind of like homework in a way. It's a bit like having your coursework. And then the practical side of why you're at work is kind of it's just like your day-to-day of working, but you might just have to write it up as like a reflective account of what you have done. And then
you have to. No, you carry on.
So I was just going to say, sometimes you normally have like a workplace mentor as well, who's sort of there to support you, and they kind of sign off all of your reflective accounts as well.
Great stuff. What was I going to ask you now? Oh, I know. Did you have exams at the end of your apprenticeship, or was it all coursework and kind of placement?
So personally for me, mine was all coursework and placement. But I know some of the newer apprentices who've done the course since I finished mine probably about 3-4 years ago. They did have like an end of sort of a unit exam, or like one big exam at the end of theirs. But honestly, don't let it put you off. It's completely just to prove that what you've learned throughout your course, you're going to be putting into practice, and you understand the importance of what you've learned. It's nothing to be put off by.
And it sounds like you were really well supported through the process, both from the college point of view and from the work placement point of view.
Yes, definitely. Honestly, it's one of those, any problem, no matter how big or small, there's someone always a phone call away, an email away. And then you've got that added bonus of someone actually on work side to go and talk to.
Thank you, Joe. And Rita, if I could come back to you, could you tell us what do you love about your job? What's the favourite bit of your job?
I think it's putting into practice what I learned in my degree to the extent of getting down to exactly how drugs work in the body, because I feel like normally when you're checking drugs on charts, you're kind of just going through accuracy checking and making sure that clinically they're safe. But I think with critical care, there's a lot more involved with the drugs, for example, putting patients to sleep, waking them up, supporting their organs, for example, their heart, like the heart drugs I spoke about. And there's a lot more, I think, particular monitoring for them. So it allows me just to be a bit more conscientious with blood results. And I think it just gives me that extra, I guess, immediate result of the decisions I make. So sometimes if we ask to, I guess, reduce a certain concentration of a medication, because our conditions are quite acute and the patients are quite acutely unwell, you can kind of see the impact you're making quite quickly. So if a patient's heart's not beating to the rhythm that's supposed to be, and we adjust one of the heart medications a little bit, you can see the rhythm correct like within a few hours. So it's just, I guess, that immediate, impact that you're having on that patient, just seeing that. And I think that's probably one of my most favourite parts of my job.
I think a lot of kind of as you get into working life and maybe, you know, progress, move between different jobs, it's about working out what you enjoy, isn't it? And kind of, but also important to work out what you're not so keen on, because that, you know, that's important too, and kind of it can help direct you. Have you got ideas about where you might want your career to go in the future, Amrita, or are you just kind of playing it by ear at the minute?
Well, to be fair, when I was younger in my career, I'd never worked in critical care before. So me coming into this role was quite on the whim, as in the right opportunity came up at the right time. And I think my role was a 7 to 8A step up. So that basically means that they train you for the year, heading towards the promotion. So when you do have the promotion, you have the skill set. You're kind of not just kind of thrown into the deep end kind of thing. So when this job came up, I felt like it was the right way to train. So in terms of my future, I definitely see it in relation to critical care. So at the moment, I'm a specialist, so I'm an 8A. So the next step would be an 8B in the same area. So if the right opportunity came up, I'd love to be in more of a leadership role within critical care. But if something else came up within another specialty, one thing I love about pharmacy is that you can just start from scratch again and learn on the job. So I'm not opposed to heading towards that, but in the distant future, I definitely, it's a big aspiration, but I would love to be a chief pharmacist of a hospital. I'd love that. I just love working with people, and I think I definitely would like to see myself in a leadership position where I can make more of a direct change in terms of service level. But yeah, that's like the end goal. But at the moment, I'm happy to look at like the next 2-3 years, so maybe like an 8B or something somewhere.
Brilliant, thank you. But it's great to know, isn't it, that there is something, you know, there is real opportunity to progress in terms of, you know, whether you're going down a leadership route or a specialist route or an academic route for some people as well, or research. So yeah, lots of options. Brilliant, thank you. Okay, just before we start answering some questions from the audience, just want to ask whoever of you wants to respond, all of you, one of you, doesn't matter. We might have some people watching now who are maybe considering a career in the NHS, but not quite sure what they want to do. What would you say to someone kind of thinking about a career in the NHS, and perhaps sort of teetering on the edge of making a decision?
I was just waiting for someone to go first.
Go on, Wendy, you look like you're about to say something.
I would just say I would 100% recommend it. First off, just for the satisfaction that you get. I do see patients coming in sometimes feeling very low because like they've just been diagnosed with diabetes. They feel like their lives has just ended. They can't eat their best donuts. They can't have their best chocolate. And I think it's the whole idea of just sitting with them, say, we can make small changes and you can get to the other side and you can still enjoy this actually like the things that you love. And I just see like just the growth of people actually helping them build discipline, helping them come back to like being not normal, but then getting like their diabetes in remission. It's just like a joy to see them. And also with patients being so grateful that they have people that they can speak to. I just feel like that brings me so much joy. Just to see a patient saying, hey, you actually helped me. I don't have diabetes anymore. So let's go for a cup of tea. It's just amazing. So yeah.
Oh, that's really lovely. Thank you, Wendy. And again highlights that it's not just, you know, like we were saying with Joe just then, it's not just, you're not just talking to people about medicines. There's a wider context, isn't there, and a wider conversation going on. So that's really lovely. Joe or Amrita, anything you would say to someone not quite sure?
Yeah, I think for me is that the fact is I think until you sort of realise and start looking into it, how big the NHS actually is. And it's got so many resources available. It's like there's apprenticeships, there's learning on the jobs, there's progression once you're here. And like you say, once you get trained in one area, there's nothing to say you can't sidestep into a different area as well. So I would just say the NHS is an amazing opportunity to consider, to sort of, even as just a starting point, to consider what you might or might not like.
Thank you, Joe. Amrita, you don't have to add anything, but is there anything you want to add?
I think it's more from like a health and well-being perspective. I think if you're somebody that feels that they want to be in an environment that they feel supported and heard, I definitely feel like in the NHS, the experience I've had so far, there's always someone like behind another door, in another office, down the corridor, on the ward. Like, there's always someone there to like ask for help. And whether that be academically, like Joe just said, to, you know, progress or train, or that be that you're that like listening ear for that patient, like Wendy said. But I think it's more when you feel like there's a need for something, the NHS, I feel like, will always try its best to meet that need, whether that be arranging for you to go for extra training, extra classes. They also have health and wellbeing sessions on, yoga sessions on in the mornings. Like, there's just so much more. Like, a job is about, I'd say, 80% of your life at the moment. You spend more time at work than you do at home. So I think if you're doing a job somewhere you feel supported and heard, I think the NHS is definitely where that's at. So if you guys are thinking about a career in the NHS, definitely get yourself on a placement and just have a little taster session on the field that you're interested in. But yeah, that's probably what I'd say.
Lovely, thank you. And really a lovely selection of answers from the three of you then. So thank you very much. Okay, right. I am just going to, I need to look at my phone because one of our team members is sending me the questions that you're putting in. So I'm not sorting out my social life. I am looking to see what's going on behind the scenes. Okay, now, apparently the picture has been really slow on this, so we are really sorry. It sounds like there's quite a lag, so thank you for bearing with us, and hopefully, you know, if you sit there long enough, you'll get to hear it all. Right, so someone here has asked, they said, I currently work as a healthcare assistant. Are there opportunities for me to join the pharmacy team? Anyone want to have a go at that one? If not, I'm happy to have a go. But
I'm happy to sort of jump in on that.
Go on then, Joe.
I'd say probably from what you're doing now, there's absolutely no reason for you not to go into maybe understanding maybe what like a pharmacy assistant does, or potentially start onto a pharmacy technician course. There's sort of levels that you can go in at that you just need your GCSEs. And no prior experience as well with the NHS. They're more than happy to sort of take you from ground level and work your way up in terms of knowledge. So I'd say 100% that's a way in to consider into pharmacy.
Thanks, Joe. And just to say, whoever's asked that question as well, that your experience as a healthcare assistant is going to stand you in really good stead for getting stuck in a job in pharmacy. So you might want to have a chat to your line manager, or go and speak to if there's a training and education department if you're working in an NHS trust, or approach perhaps the pharmacy manager, someone in the pharmacy team. But jobs and apprenticeships will be advertised on the NHS jobs website. So that's jobs.nhs.uk. So that's where you'll find those. But yeah, opportunities. So have a look and go for it. Okay, someone else has said, I'm a level 5 health and social care student. Can I switch to pharmacy? What training is available? Again, anyone want to have a go at that one? If not,
so it sort of depends. So I think you can definitely switch, but it depends on the university. Because I remember at one of the universities, I think it was Wolverhampton, potentially they do like a foundation program. So you do, like, even if you've done a course somewhere else, or you've done like potentially maybe not the A levels in the subject area, don't quote me on this, but I think this is how it works. That you do like a foundation year where you kind of make up the content that you might not have covered in those subjects, and then if you pass that foundation year, you then get let onto the pharmacy program. I think that's how it works in Wolverhampton.
Yeah, you're absolutely right, Amrita. There are some courses that do that. So if it's a pharmacist that you want to become, then you can have a look on our Health Careers website. If you find the course finder, if we can put the link in the chat, we will do that for you. But if you go to our course finder on the website, you can put pharmacy in, and then you can have a look at all the universities that run pharmacy courses, click through to the university, and then you can look at the entry requirements. As Amrita said, some of them do offer these foundation years. So if you haven't got those level 3 qualifications that you might need, so exactly the right A levels, then there might be a way in. The other option would be, as Joe was saying just now, is, you know, if you're interested in other roles in the team, then pharmacy assistant, pharmacy technician training could be open to you. So yeah, go for it, do your research and see what's out there, and good luck whatever you decide to do. Okay, so someone else has said, I work as a healthcare support worker but have experience in pharmaceutical manufacturing. What pharmacy opportunities are there in the NHS?
We have an aseptics department within our pharmacy department. So they do the making up of parenteral nutrition and chemotherapy. So there's a lot of transferable skills that you might have to use in our aseptics department. But if you want a complete change, then there's always other places such as dispensary and ward-based drug history taking, which I'm sure Joe would know a bit more about. But yeah, so I think aseptics is something that's quite a transferable skill you could go into.
Yeah, but I was just going to add, sorry, to that one. I know at our hospital in Nottingham, we've got like a cytotoxic lab,
Yeah.
we've got an aseptics unit. There's also like a non-sterile manufacturing. So there's loads of transferable skills there, sort of within a production side of pharmacy, if you wanted to go into that.
Great stuff, thank you. So hopefully that's given you some ideas to go away and have a bit of a look at. Okay, I've got another one here. So I'm a year 13 student. Do you have any tips for a personal statement for pharmacy? Good question. Wendy, do you want to come in on this one?
Yeah, I was just going to say, if you've done your, if you've had a replacement, if you haven't, I would say there might be a chance to look at placements. You've already had it. I think what is important is actually explaining what you've learned. So don't just state that you had a placement in a GP or in community. Actually state what you've learned. Did you see pharmacists working with other healthcare professionals? So talk about working in a multidisciplinary sector. Did you see pharmacists providing person-centered care? Talk about that one. And it might be worth going through the pharmacy standards and matching them to what you saw in there. So with the pharmacy standards, we do have person-centered care, using professional judgment, multidisciplinary team. So do match what you saw to these statements and then explain what you've learned from there. So yeah.
Great tips, thank you, Wendy. And Rita, I don't know if is there anything else you'd add in terms of personal statements?
So for me, I got told this once when I went to an oral interview. I remember it was in a lift. Somebody gave me the advice because I looked nervous. They said to use the STAR technique whenever I'm writing an answer. So that basically means situation, explaining what it is, the task, your action, and also your reflection being the most important. So when you are relating back to how Wendy said, those situations or those standards, and you're giving examples, just make sure you're reflecting on your examples in your answer, because it kind of shows the person what they need to tick off when they're giving you the scoring for your statement. It's kind of guiding them to giving you more points. So it's probably not pharmacy specific, but that's a technique that I think works really well.
That's great, thank you. And that, you know, that obviously that's really well aligned with what Wendy said around that reflection. So it's not about having the most incredible work experience placement ever. It's about what you take from it, isn't it? It's about what you observe around you, and how you can reflect on that, and how you can evidence that you're the right sort of person for that, you know, that training, that job, that apprenticeship. Okay, another question. Someone said, any tips for NHS job applications? Joe, any thoughts on that?
I think for sure, in terms of the online applications, I think one of the most is just go through the job specification and just kind of, even if you print it off and kind of tick it as you talk about it, and just try and show you've got the skills, or that you to sell yourself as the right person. Just relate it to any part of your life, really. It's like you say, you don't need the best work experience in the world. It's about showing that you've got the skills to be able to do that job. And also, I know all of the different NHS trusts always have their values and behaviours. I know that's really quite important. So just have a quick read of them, and again, relay how you think that they integrate into a daily work life.
That's absolutely spot on advice there, Joe. And you know, there are the NHS values from the NHS Constitution, but also, as you say, most NHS employers have their own set of values as well, and that shows you've done your homework, doesn't it? It shows you really want the job. The other thing I would just add is that on each job advert on the NHS Jobs website, you'll see a named contact. Give them a call, you know, before you apply, before an interview. That's what the number's there for. It shows initiative, and you might find out some kind of, you know, some extra information about the job you're applying for. And Rita or Wendy, anything else you want to add in terms of applying for jobs?
I was just
Top
going to
tips.
say, don't be humble, because a lot of people try to downplay their skills. Just like, well, be humble within a reason, but just sell yourself. So put your best self forward, because I know people just write, oh, I'm good at this. Don't say you're good at this. So you're excellent at this. You've been doing this for a long time, so you're actually well equipped and expecting that. So do sell yourself a bit more. And yeah, also it might be nice if it's quite close, just to go in there. If it was a surgery, just to go in there as a patient, or just walking around, see how it's like, and see whether you actually like it. So in as much as you want the job, also, is that the right place for you? Do you like the people there? Do you like the environment? So yeah.
Brilliant. I love that. Thanks, Wendy. Right, talking of work experience, we've been mentioning that already. Someone has asked how they can get work experience. Now, we know this can be a really, really thorny issue, because there doesn't tend to be the capacity there for all the people that want work experience. But any top tips? How would you go about it if you were trying to get work experience now?
When I was in university, I was looking for a Saturday job at local Lloyd's pharmacy. What I did was I just literally printed off my CV and had it ready, and just walked down like all the high streets that I knew I wouldn't mind commuting to, and just dropped my CV off. And a lot of them, obviously, you probably, let's say you gave them to 10, you might hear a no from like 8, but you'll actually get 2 that might say yeah, sure. And if they can't offer you a job, they can offer you that work experience placement. So it's kind of like knocking, do you know what I mean? You're kind of getting the job potentially, or you're getting the experience. So, and also when you're at university, or, you know, work when you're younger, you want that Saturday job sometimes. So it kind of works to the benefit of both. So yeah, I'd say just try and get yourself out there. Maybe just doing the footwork and going in person maybe just makes that little extra difference, instead of being behind, I guess, an email.
Advice. Thank you, Amrita. Anyone else, Wendy or Joe, anything to add there?
Don't be scared of rejection. I recently had to look for job work experience for my independent prescribing, and you would send a lot of emails, you get a lot of rejections. But I think also what is worth is actually finding a named person within the so if it's a hospital, then apply for a job experience in the hospital. Just find the main person in charge of that and send them a personal email. And then also try and say what you can bring to the team. So they will be given their time to you. Just say, I'm happy to also do this as well, just so that they know that you're not just there to gain and collect from them, but you're also happy to actually help them out and should they need help. So yeah.
I like that. Thank you, Wendy. But yeah, it's right. So get, you know, if you've got an NHS trust near you, get on their website, put work experience or volunteering into the search bar, and see if you can find an email address or a phone number. The slightly confusing thing about the NHS is that it is made up of all these separate employers, and each one of those organisations will have a slightly different way of doing things. Some might have the most incredible work experience opportunities, and others might have very, very little. Joe, I don't know if you don't feel you have to, but anything you want to add? Did you ever try and get any work experience in?
Looking back on it, when I was in my year 10 doing your year 10 sort of weeks work experience, I did apply to a couple of pharmacies, but also to another kind of job that I was considering at the time. But I did hear back from one of the pharmacies, and they were willing. And I do remember they said to me, I went round with my CVs, and they went, we like the fact that you actually came in person and showed a smile and interest. So yeah, get your face out there and just show that you have some care in you, that you actually want to learn this, is probably the best tip.
Yeah, that you're not just doing it as a tick box exercise because I've been told I've got to do some work experience. Yeah, brilliant. Okay, right. I think that is it in terms of the questions, and that's brilliant timing. Massive thank you, Amrita, Wendy and Joe, for joining us. It's the end of a Monday. Mondays can be tough. You've stayed later than you normally would. Thank you so much for giving up your time and telling your stories and giving those top tips. It's been brilliant and interesting and inspiring. Thank you to all of you who have joined us watching. We really hope you've enjoyed this, and obviously this will be available on catch up if you think someone else might want to watch it, or if you want to watch bits back afterwards. Thank you for all your questions as well. It's been a really nice range of questions, so that's been